Thanks for taking the time to watch this video. We put this video together as a set of instructions for you after the ear tube surgery. In addition to this video set of instructions, you should also have received a set of instructions that look like this, okay? Fluorescent piece of paper, and you'll also receive the same information in a graph that looks like this, okay? Now, the reason that we put this together in these three different forms is that some people find it easier for them to hear the instructions, kind of like we're doing right now on this video. Other people find it easier to read the instructions, and other people find it easier to see the instructions. So this way you'll have it in a number of different formats. And if you have family members who are interested in knowing exactly what to expect, then this is useful for them as well. Okay, this is something that you can share with your family members since many of you will have gotten these instructions before the day of surgery, and that way you'll be able to review them with your family members. And if you have any questions or concerns, you can refer back to the instructions both in the written format and the graph format and in this format as well. So let's go over what to expect after ear tube surgery. Okay, so tympanostomy, which is the technical term for making a hole in the eardrum and then placing the tubes in the ears, is how we treat what's called eustachian tube dysfunction. It involves a problem with the middle ear space. And so after surgery, you should expect that after having made a hole in the eardrum, that it's not unusual for there to be a little bit of blood or other fluids that come out of the ear. That's very typical. It's nothing to be worried about. It's nothing to freak out about. It is something that typically happens. Some people find that putting a cotton ball in their ear is helpful afterwards in order to prevent a big mess on their clothes, and that's very reasonable. There are a few things in particular that you do need to pay attention to. So number one, please don't put any fluid in the ear if we used Otiprio, okay? And if we were planning to use Otiprio for your ear surgery, you will have gotten a sheet that looks kind of like this, okay? And this is an information sheet about Otiprio. Our clinic is one of the few clinics in the entire state of Nebraska which uses Otiprio, which is a long-acting antibiotic in the middle ear space. It's the only thing that's been shown to decrease the number of ear infections after ear tube surgery, and has the added advantage of helping the parents because you don't need to use eardrops after surgery. In the past, I would routinely use eardrops in kids' ears after surgery, but as you could tell from this information sheet, a lot of people have difficulty remembering to put the drops in. Other kids don't like having the drops put in, and so this is one thing that is particularly convenient for the patient and the parents, but it has the primary advantage of avoiding the need for eardrops and the primary advantage of decreasing the number of ear infections that the patient will have after surgery, okay? So it is important, at least for the first week or until your follow-up visit, that you not allow any fluid in the ear, okay? And that means that whether it's in the bath or in the swimming pool or swimming in a lake or something like that, that you wear earplugs in the ear that prevent water from getting in. Now, some people prefer to use cotton balls with Vaseline on them, and that's okay too. But if you're going to do that, make sure that the Vaseline is on the inside and not on the outside. Because if Vaseline's on the outside, then that actually turns the cotton ball into a funnel and you end up getting more fluid into the ear, which does a few different things. Number one, it increases the risk of having more infections later on down the road that are more difficult to treat. And number two, there is a possibility that the fluid that gets into the ear could dislodge the tube, and the tube could pop out, which obviously we don't want. And the reason for that is that when we make the hole in the eardrum, we have to make the hole bigger than the tube itself in order to get the tube in, which makes perfect sense. And it can take a few days for the eardrum to tighten up around the tube so that the tube doesn't fall out. And so it's important to keep that in mind. We don't want any fluid getting into the ear that would potentially knock that tube loose and then end up needing another procedure to put a new one in. Okay, so that's really important. So until the follow-up visit, don't let any water or any other fluid get in the ear. Okay, it is okay to wipe the ear if there's crusting or anything like that here. You could take a damp washcloth with a little soap and water and wipe that area away, but don't put anything in the ear. Okay, it's also important, as always, to avoid Q-tips or anything like that in the ear. Those types of things can cause more problems than they help with, and particularly in a patient who has a hole in the eardrum and has recently undergone surgery. So please try to avoid putting anything in the ear, whether it's a fluid or some other type of foreign object. Okay? Secondly, what to do after your follow-up visit. Now, whether I see you for the follow-up visit or Steve sees you for the follow-up visit, we'll go over these instructions with you, but I want to mention it now so that you have this in mind, and again, so that you have this as a reference for your future use. It is okay to let water get into the ears after your follow-up visit, assuming that Steve or I say that the ear tube is secure. There are a few exceptions to that. The most important one is if you're in fresh water, or if it's one of your children that had the ear tubes, whoever it is that had the ear tubes placed. If you're in fresh water, don't let that water get in. Use earplugs when you're in fresh water. What do I mean by fresh water? I mean lakes, ponds, streams, rivers, swamps, things like that. There are a lot of different organisms that grow in that water, and we don't want those organisms getting in there and causing an infection. Okay, so that's important to keep in mind. If it's any other kind of water, whether it's a swimming pool or a bathtub or swimming in the ocean, good rule of thumb is if it hurts, then you should wear an earplug. And if it doesn't hurt, then you don't need the earplug. And the reason for that is that if it hurts, that means that the water is getting in far enough that it's going past the eardrum and causing discomfort, which means it could also cause an infection. If it doesn't hurt, the likelihood that it's getting that far is pretty small. And so it's safe to get that water, that type of water, in the ear without the need for an earplug. Again, if it's fresh water, lakes, ponds, streams, rivers, swamps, use earplugs regardless. But if it's any other kind of water, then the rule of thumb is if it hurts, then you need earplugs. If it doesn't hurt, you don't need earplugs. Again, that applies after you've been cleared by me or Steve to be able to let water get in the ears, and that would be after the first follow-up visit. Okay, and then lastly, as far as follow-up visits go, typically I see patients about a year after the tubes have been put in, because the tubes typically are designed to fall out on their own within a year, and we want to make sure that they've fallen out. With few exceptions, if the tubes are in there for an extended period of time, it does increase the risk of causing a permanent hole in the eardrum, which would then later on need a bigger operation to fix. So general rule of thumb that we use in our practice is that if the tubes have been in there for 18 months, then they should probably be taken out. If they come back and the tubes are still there at a year, then typically we'll have you follow up again in another 2 to 3 months to see whether or not they've fallen out. And then those follow-ups get closer and closer and closer to each other until we reach the 18-month mark. If the tubes are still there at 18 months, then typically we'll have you come in and we'll take the tubes out in the office if that's reasonable, although for children typically we'll do that in the operating room because most kids can't hold still long enough for us to take it out in the office. Okay? As far as pain goes, this is generally not a painful operation, and so I recommend a combination of ibuprofen and Tylenol taken over the counter as needed. Most kids and most adults after this don't need the ibuprofen or Tylenol for more than a day or two. So if you find that you don't need it, then don't take it. It's not absolutely necessary in this case, but if you do find that you have some discomfort, then ibuprofen and Tylenol are the best way to go. Otherwise, all of you should have my cell phone number. Okay, all of my post-operative patients get my cell phone number. You'll find that on the discharge instruction sheet that's fluorescent that looks like this. Okay, my cell phone number will be in big bold letters down at the bottom, and so don't be shy. Give me a call or send me a text message if you have any questions or concerns, or of course you can always reach us through email at info@draguila.com. You can also go to the Facebook page, or you can go to the website. You can find our contact information that way. And then if you need to find this video again, or you want to share it with your family members, there are a number of different videos that are available both on our website as well as our YouTube channel. If you have any questions or concerns about any of that, please don't be shy. Make sure you take the time to look at the discharge instructions both in this form and in this form, okay? And that way you'll be able to answer the vast majority of your questions between this video and those two sets of discharge instructions. If you still have questions after that, don't be shy. Just contact us and let us know. We'll be happy to help. Okay? Most importantly, be safe out there, take care, and we look forward to seeing you again soon.